Podcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. Welcome to Career Coffee Talk webinar series. My name is Shannon Gallo. I'm the Manager of Career Services here at the School of Professional Studies. Thanks for joining us. Could you just take a moment and type into your chat field and let us know that you can hear us clearly, and then we'll get things started. Okay, it seems like we should be doing just fine. Once again, my name is Shannon Gallo. I'm with CUNY SPS, and this is Career Coffee Talk webinar series, Interviews with Industry Insiders. Today's industry of focus is healthcare. This is a program brought to you by Career Services at the CUNY School of Professional Studies. If you attended our programs before, welcome back. If this is your first time joining us, we're happy to have you, and we hope you find it worthwhile. Before we move into the content, I did want to show you that if you have any technical trouble, you could call 1-800-263-6317, press 1 for GoToWebinar, then 2 for TechSupport. We are eager to hear your questions today, so please take a moment, if at the beginning of the presentation or toward the end, to send us your questions. Use your chat field. You can see the diagram on your screen that shows you where you would send your questions, and you can send those at any point while I'm speaking or any of our panelists are speaking today. And finally, we are offering a live stream of captions of today's presentation. If you would like to take advantage of that during the webinar, the link is on the bottom of your screen, and it's also being sent to you in the chat field. Let me thank my colleagues Anthony Sweeney and Kelsey Richardson for their help this morning in broadcasting the webinar. So the agenda for today is this quick introduction. Then you'll get to meet our panelists virtually. And finally, I'll go through questions and answers at the end of the presentation. So don't be afraid to send in your questions for any of our panelists. Our first person that we'll hear from today is Steve Pruitt. He is a VP of Clinical Analytics and Informatics at Health First here in New York City, and I will let Steve take it from there.
Thanks, Shannon, and hi, everybody. Thanks for taking time to talk to us today. I think one of the things I always tell people looking for a new opportunity or early career folks is to have your elevator speech ready about what it is that you do. So now I guess I'm going to try out mine. Right now I run clinical analytics and informatics at Health First. It's the best job I've ever had. One of the things that we're doing there is trying to improve members' health with data. So Health First is a majority Medicaid plan serving New York City and surrounding counties. So we work a lot with low-income populations. It's a very diverse population, often a very high needs population. And my group uses the data that we all throw off in our daily lives to help members stay out of the hospital, take their medications, go for preventative care that helps both improve their quality of life and decrease the overall cost of healthcare. So my background is in technology and analytics, mostly in healthcare. I guess I have to say I've been doing this for like 10 years now, which it hurts me on the inside to say. But I went to a college in Kansas City, Missouri that no one's ever heard of called Avila University to be close to my family and played baseball, which I loved. After that, I went to Washington University in St. Louis, where I got an MBA. From there, I guess one of the things we're going to talk about is career development. I had internships both at Avila and at WashU that were very influential in my career development. I got a programming internship while I was at Avila from one of my programming professors, And then I got an internship at Pfizer, actually through a family acquaintance, right? That then I ultimately leveraged into a job. So that was, both of those things were important in my kind of early development. I did some portfolio stuff at Pfizer, and then I took that kind of a bigger job at a smaller company to do that at a firm called Charles River Labs. From there, I went to management consulting, where I did a lot of large system implementation work, mostly in oil and energy, actually. Then I came back to the Visiting Nurse Service of New York, which is close to what we do at Health First, right? It's a not-for-profit home care agency and health insurance plan where I ran business transformation, more large system implementation stuff. And then I spun off and started a new group at VNS called Product Innovation and Solution Development. This is where we did a lot of analytical work focused on bringing new home care-oriented products to market. In other words, serving a hospital for special surgery when you go and get a hip replacement and need to go home. It helps if you have somebody to take you home, and for people who live alone or who are frail and elderly, it helps to pay somebody actually to escort members home. It's just one example of programs that we designed while I was there. And then after that, I came to Health First, and since I've been at Health First, we've been building out data infrastructure to deploy machine learning models and predictive analytics that, as I say, can help improve the quality of care our members receive and lower their overall medical costs. So I'm pretty sure I hit 5 minutes there. I will just awkwardly trail off now.
Thank you very much, Steve. I appreciate you sharing all of the information about your education and your early career. In fact, mentioning some of the instructors and people that you know that were helpful to you early on. Can't wait to hear more from you later when we go through some questions and answers. So don't forget to send them in as we're moving through our next group of panelists. Our second panelist today is Eric Jackson, and Eric works in talent acquisition and recruitment in healthcare. He is joining us from the Atlanta, Georgia area. He is with Wellstar Health System. So Eric, I'll go ahead and let you take it away from here.
All right, thank you again, Shannon. So good morning, everybody. Just wanted to thank you all for coming in and also for letting me be a participant, just kind of to share my experience with you. So I went to the University of Michigan. That's where I got my undergraduate degree. And I was a psychology major in undergrad. That was not my initial plan when I had went into school. I had initially wanted to go to business school. But when I didn't get into the business school, I kind of had to figure out a plan, figure out what I liked. And I really got into psychology from an introductory class I took from my first year there. So when I finished undergrad, I actually went to law school for about a year in Los Angeles. And then after that, I came back to New York and I started taking graduate classes at the CUNY SPS school, which is actually where I met Shannon and how I got my first HR internship. My first internship was at the Department of Health and Mental Hygiene in Queens. I worked on a lot of different things, and it was really one of like my first experiences, I guess, professionally that I really enjoyed. I had done some internships in college, but I think my internship at the Department of Health and Mental Hygiene was just really enjoyable for me, not only because of the staff I worked with, but all the events that I got to do. I helped coordinate blood drives. We did a lot of employee recognition, and then I got to work on, just some of the back end stuff in terms of reimbursing interns, kind of managing volunteer programs and our volunteer coordinators. So that's really where I got my first taste of HR and kind of, what helped propel me further. And from there, I went to Battery Park City Authority, and that was a paid internship where I split time between HR and public information. I really enjoyed that internship. I would say the public information aspect of it, even though I did not go down that route ultimately, it was enjoyable just for me. I got to go to a lot of like ribbon cuttings. I got to write press releases. I would update Battery Park City's website. So it was just a really fun job and something I really enjoyed. And after that, one of the other things that I have not only did early in my career, but also now, I worked through a temp agency, which I think is a really good way, you know, to get experience and sometimes something, you know, that's overlooked. My first job at Premier Home Healthcare, I could not have gotten that job had I not had my HR temp job prior to that. So when I was in that temp job, I worked at Saber's Dipping Company, which is the hummus company in White Plains, New York. And that's really kind of where I just built some basic skills, you know, that helped me get, you know, my first permanent position. And when I went to Premier, basically how I got into talent acquisition was kind of by accident. One of my supervisors who I used to support, that was the area I worked in. And then one day he had a special assignment and they moved him to a different office. And then from there, that's kind of where my talent acquisition career began. I've pretty much been in healthcare since I've started. I started doing recruitment, I would say around March of 2015. And I carried that into my next opportunity at Services for the Underserved, which is a nonprofit in New York that mainly deals with, you know, populations that are, you know, in need, whether it's low income, they are dealing with adverse health outcomes. So I continued doing recruitment there, worked with the Developmental Disabilities Department, and about a year and 2 months ago, I moved down here to Atlanta. Just wanted to try a different city, have some family and friends here, and that's how I ended up with Wellstar Health System. And Wellstar is the largest health system in Georgia. We are a nonprofit health system also, and there are just a lot of opportunities here. And this was really a big thing for me in my career because I had never really recruited for the amount of different areas that I'm doing now. I not only focus on, you know, healthcare related, you know, positions, but also the business side of, you know, what supports, you know, the system as a whole. So I've had the opportunity to learn a lot, to participate in a lot of recruitment events. And I just think one of the things I've learned, you know, throughout my career is sometimes, you know, whether, you know, something doesn't work out or something, you know, doesn't, I guess, fit, you know, whatever you have in your mind, you know, whether it's your roadmap for success or how you think your career is going to turn out. I think sometimes, you know, through unexpected things, you know, you really kind of find what you're looking for or really, you know, identify what you want to do. So that's just kind of how my career has been developing and, you know, currently what I'm doing now. So I'm ready to transition to the next person.
Thank you, Eric. It was interesting to hear some of the different directions your career path has taken, but also nice to see that you've landed in a place that seems comfortable and rewarding for you at this point in Atlanta. So thank you for sharing. At this point, we'll go ahead and move to our third panelist today, another SPSer, as I like to call them. Maureen Levetro is a certified child life specialist here in New York City at NYC Health and Hospitals Corporation. So Maureen, take it away.
Hi, everybody. I'm really excited to be here. This is my first webinar. So as a child life specialist, not a lot of people know what it is, but it's a really, really fun job. So basically, my job is, I'm not a doctor or a nurse or anything. I'm just there to make sure the patients are as comfortable as possible and understand everything. So being in the hospital could be very traumatic. Usually, if kids are young, they don't have the words to say, like, I'm scared, or this is bothering me, or I don't know what's going on. But we can do that through play. So typically, I'll have like a medical play doll, or just a doll or their stuffed animal. And 9 times out of 10, whatever reason that brings them to the hospital is what's bothering their doll. So they might say, oh, my doll's in the hospital because they have appendicitis, and the doll will have the same ailment. And you can use a lot of child-friendly language to explain that. If I'm helping children with a medical procedure, I might prepare them with a book to show them exactly what they're going to expect, or to help them get through a difficult procedure like a blood draw or something. I might like hold their hand or blow bubbles, or there's something called comfort positioning, which means that they'll sit in their parent's lap in a certain way where the parent is still holding them, but the doctors are able to do whatever procedure without them moving around so much. So it's definitely something that I really, really enjoy. Before I got my position, I was actually an intern at my hospital, so I can't stress enough telling people to volunteer. I know that people might say, oh, I don't want to work for free, or I have a degree, but I volunteered for 3 years before I got my internship and my position, and it's great because it gives you work experience and it proves that you could really be in whatever profession you desire. And then the department at whatever agency you're working for, they will realize that you're not just like a name on a paper. They'll see your worth ethic and that you're willing to pitch in, and really you're passionate for whatever field you have. So I would definitely encourage volunteering. And one great part about my job is I also have a service dog. His name is Drake. So I take him with me to when I work. So it's great because the kids aren't expecting to see a dog. So I can use like the element of surprise to encourage them, or support them through a stressful time. And also, a lot of my patients are non-English speaking, so the dog is a great barrier to like a language. I don't need to speak their language. Really, everybody loves working with a really cute dog. And just in general, I love my job. And one thing that's great about it is every day is different. And also that you really get a sense of satisfaction when you can help a child through something that would be really scary, but then you can see that like aha moment where they click and they're really proud of themselves because they made it through a certain procedure. And I'm looking forward to hearing any questions that you guys have.
Thank you, Maureen. Maureen, as I had mentioned, she also has her degree from SPS. She is a master's degree graduate of the Disability Studies program. So it's nice to have her returning to join us for today's program. So we've heard from all three of our panelists today, and now we're going to go ahead and move into the portion of our presentation where we'll answer your questions. So I see that we do have a couple of those that have already started to come in, and I will go ahead and start moderating through those with our three panelists. Please feel free to continue sending them in. We have about 25 minutes to go over your questions, so I hope that you will send them in and we get to address a lot of them today. So I'm going to go ahead and start out with one that I think I'll ask all three of our panelists to answer. We'll go ahead and start with Eric. This question is pretty broad. Eric, the question is, what do you look for in candidates most when hiring? And this is a pretty broad question, so I'll go ahead and make it a little bit more specific. In particular, when you're hiring candidates for positions in nursing or informatics or positions related to those areas, what are some of the most important things that you look for?
And I can definitely more so talk about the informatics one. I do have some nurses, but a lot of my nurses are also abstractors, so it kind of overlaps. For me, I would say from the very first thing, we get a lot of applications and resumes. So one, just from like a resume and from an aesthetics point of view, I would say it's just something that's easy to read, because when everybody lists out, that they've used a certain type of program, or if they know something like SQL or Excel, or they know how to manipulate databases, everybody, typically has that in their resume, or people, that meet the basic qualifications. So what I would say I'm looking for in a candidate, one, just something easy to read. And then if there is something, where you can kind of distinguish your experience, or, kind of highlight it so it looks, I guess, different, from what comes in, as far as the masses. So to give you an example, one of the analytics related positions that we have data transformation analysts, and then we have senior productivity and benchmarking analysts, that kind of help feed data to different parts of the system. And in the people that we've hired for those positions, the big thing that helps, even if you've never worked in healthcare before, and even if you may have not necessarily have done this kind of work, if you've had a type of internship, or you've worked, with one of the programs that we use to feed data, those are the things that we really look for, and that our hiring leaders like. To give an example of the last person that we hired them from another company in North Carolina. And the big thing was, even though they had, limited, I guess, analytics experience, they had actually worked, with the program that we went live with recently. And while they on the surface may not have had as much experience as some of the other applicants that came in, because they made it clear on their application that they had, been experienced with this software, it was something that caught my attention. And then when I sent it to the hiring leaders, they looked at this person and said, while they may not have so much experience, this is somebody that we can mold and somebody that we can teach and kind of fit into our system. So I think little things like that, just finding ways, to highlight something you've done in the past, are really important, and something that is going to catch, whether it's a recruiter or a hiring manager, because sometimes we see a lot of the same things on resumes, just people work in different places, but certain little things like that, that stick out, I think are probably the ways a candidate can distinguish themselves, out of a crowd of many.
Okay, thank you. Some similar questions are coming in, so I'm going to turn things over to Steve for this one and get his perspective Do you feel that an MS related to healthcare informatics is necessary for entry into your field?
No is a short answer. Longer answer is it depends. So
Okay.
if you spent 10 years as a painter and then you want to job in clinical analytics, like it would help for there to be some story that connects that part of your career to what you want to do next. So one way to create that story is to say, I went back for a master's in information science or health information or healthcare informatics. These would all be degrees that we have people on public health masters. We have all kinds of biostatisticians, that kind of stuff. That it creates that inflection point and helps change the story. But I would say, I majored in computer programming and I have an MBA, right? The stuff that I do every day mostly didn't exist as a discipline when I graduated college. So the latest tools and technologies and approaches, which were theoretical when I was in school, are now the things that we do every day. So the idea that you're going to go to school and learn something that's going to be relevant for you for 10, 15, 20 years in my corner of the world is bananas. Like, that's definitely not going to happen. So, I think intellectual curiosity and energy are the most important things that we look for in people, and that can manifest itself in a lot of ways. One way is in a degree. Another way, as we were talking before the panel, there are ways you care about analytics, and you care about data and data science. There are ways to show about those things on your resume. You can build a GitHub profile. You can build a Tableau Public profile. You can write blog posts about your thoughts about ideas to be tackled with those tools and methods. So no, it's not required. And I would say that some of my best analysts, my director of analytics is a recovering musician. Right. And actually, we have a lot of musicians. I think there's something about the math and the music that attracts people. It's odd, but so I have kind of a merry band of misfits. It's not, in my opinion, a job where you have to, major in engineering, get a master's in engineering, and then go be an engineer. But if those kind of basic technical skills aren't in your background, then a master's in the field is a good way to tell people that you're serious and that you've acquired the necessary technical skills to actually do the work.
Great. And this sort of addressed another question that had come in. How can an individual who's worked maybe in public health transition into an HIM area? And I think a lot of what Steve just shared with us relates to that as well. Let me turn things over to Maureen and ask her a similar question. Given that you're one of our three panelists who works directly with the patients in the clinical and care setting, Maureen, what do you think are some of the most important qualities that you have, or what are some of the most important qualities for someone other than the obvious, for someone like a nurse or in a child life specialist role? What do you think are some of the most important qualities for that person to have to be successful on the job?
Well, I definitely think with child life, the field is very competitive, but if you love it, it's something that you always will enjoy. I like to tell my patients or interns that I work for hugs. So you're not really working for a paycheck, you're more working to just feel so proud of your patient when they have mastered something or went through something hard and came out better on the other side, and really just helping them navigate through the process of a medical procedure, but kind of being with them in the moment and being able to share just a little bit of yourself to show them that you're trying your best to sincerely help them. One of the reasons why I chose child life was I spent a lot of time in the hospital as a child, and of course everybody's hospital experience is different, but I can kind of relate to some of the things that they've been going through. And also, when you treat pediatric patients, you also need to treat the whole family. That includes parents and siblings, because if the parents or siblings are anxious, your patient will be nervous as well. So just kind of picking up on those nonverbal cues and tuning into what your patient needs.
Thank you, Maureen. I appreciate you sharing that. I know I've heard your story previously, but it's always refreshing to hear the pride that you take in your work and how you feel for your patients. So thank you for sharing that with us. Let me move along into sort of some different questions, and let's get into maybe some of the advice that the three of you have for our attendees. Eric, I'll turn over to you for this one. What do you, in that you do hiring yourself, what are some of the, maybe give me 3 or 4 pet peeves that you have when you are interviewing candidates or just sort of the whole process of recruiting candidates? What are your 3 pet peeves?
All right, if I had to, I'm trying to pull together some really quickly. I would say one of the first things, I guess that as a recruiter that you don't necessarily, want to deal with, or that makes it a little difficulty. You would be surprised at the number of people that maybe don't necessarily have an idea of what it is, they're applying for, or, what they're looking for. I definitely have been in a position before where I've had to apply to a lot of jobs, so kind of just trying to see if anything sticks. But one of the things I come across a lot, and this I would say is more for some of the entry level positions, like I will have sometimes people that, they don't know what WellStar is, or they don't, even know what they've applied for. So I would say that's definitely number one. Even when I reach out to somebody, even if you just know a few facts, or, you're just honest with me in the beginning, I think that goes a long way. I guess, so that unpreparedness, I would say sometimes is kind of a pet peeve. And then the other thing I don't like, or I would say that makes it difficult, one of the things I try to do as a recruiter and a talent acquisition consultant is I try to set candidate expectations in the beginning about salary, how the process works. As a candidate, when you're taking somebody through the process, I just think, if you are looking for other jobs, or, something is not going to work for you, it's okay to say that in the beginning. I think sometimes people are nervous, or they're hesitant, if a certain salary doesn't work for them, or, they are entertaining other opportunities. If you're just upfront, it one, helps me do my job better, but it will also, help you throughout the process.
Hello?
If they do decide to go somewhere else, we're kind of left in the dark and, forced to scramble. And then I would say, if I did have a last pet peeve, just trying to think really quickly. I would say really those are the only 2 things. For the most part, I think the candidates that we get, they've done their part. Those are the 2 biggest things that come to mind, just not being transparent in the beginning, and then maybe with a few candidates just being unprepared.
Okay. We're sitting here in the conference room sort of shaking our heads and agreeing with you that it's frustrating about, candidates not being prepared. So I appreciate you sharing that advice. Steve, let me turn it over to you and rather than not necessarily what your pet peeves are, but I know we were talking before the panel a little bit about networking and, sort of taking steps to try and build professional relationships. Can you talk a little bit about how important networking has been in your career, or how you would advise people to be successful with it in theirs?
Sure. So I guess it's I relay the story from our intern program this year. So I gave a little introductory speech. What I should say differently. When I started a firm, I like to know like what they care about and how they make money, and like what the layout of the power structure is and how real decisions are made, and a bunch of stuff that they frankly just don't tell you in orientation. So I usually hunt around, and especially with my consulting background, you get kind of, you're a professional at going into new situations and hunting around and figuring out how these things happen. So I wanted to just spare our interns, who are only there for 8 or 10 weeks, having to do all that reconnaissance and give them speed. Like, this is what I wish I knew when I started. And as part of that little introduction, I challenged our 50 interns or something to have coffee with a senior person while they were there. And it's amazing, if you are intellectually curious and energetic, how many people will just like sit down with you and tell you how they got to where they are, or give you advice about whatever it is that you care about. And if you put just a little bit of energy into understanding the perspective of the person that you're asking, like, they'll do anything. So I tried to relay that to our interns, and I actually challenged all 50 of them. It was like, take me to coffee. Like, I'm not going to invite you, but if you send me a meeting invite and say, show up at Starbucks at 10:30 on a Tuesday, like, I will show up. Because I think part of what holds all of us back in networking is either A, you feel intimidated by asking somebody whose opinion you actually care about to give you advice, or B, you don't want to be in a position, or you don't think that you're going to have something interesting to say. And when you actually go and do it, what you don't realize is, as the networking requester, like, you flattered the person that you've asked. You said, I think you're interesting enough that I just want to know how you got to where you are. And so I ended up having coffee with 35 interns, right? I was really jittery the whole summer for drinking all this coffee with interns. And even in that span, I guess I'll just go on to say that is an informational interview. Like, that's not what we called it, but that's what it is. And so the breadth of preparedness in those interns was massive, right? Some people were really interested in analytics, and they wanted to both tell me that they were interested in that and ask me specific questions about my role, and those were very successful conversations. And some people literally showed up to coffee and said, well, you told me to ask you, which I thought was bananas. It's like, that's worse than not asking me. But I hope it was good practice for them. And for me, like, I like connecting with early career people and finding out, like, when you're at a place, it's easy to for people who are not at that place to say, oh, I wish I was there. But when you're actually in a place, it's easy to look at people earlier in their career and say, well, you could do anything you want, right? So all roads are open. So I think I hope it was good for them, and it was definitely good for me. So I think it's important to find people that you respect in the world and, like, ask them, how'd you get there? What are you interested in? What do you look for? And that's the reason I showed up today, right?
Yeah, I think it's such a powerful story. We provide advice to job seekers within SPS and CUNY about networking and reaching out and informational interviews. And you always hear the expression, it's not what you know, it's who you know. But I also like to add, it's who knows you, because that was a really nice opportunity that he put out there for those interns. And it sounds like a number of them really took full advantage. So it's important that if you have those opportunities, that you take advantage of them, or if you don't necessarily have them provided for you, that you try to seek them. I think that all of those things are really important. I'm realizing that we just have a couple of minutes, so I want to go ahead and speak with each of our panelists and ask sort of a closing question. And I'll go ahead and turn things over to Maureen to answer this one. I always think it's interesting to ask this on these types of panels. So, Maureen, if you weren't working as a child life specialist, what do you think your career would be?
Well, that is a very interesting question. When I explain what child life is and how I really enjoy working with patients and everything like that, like, people are like, well, it fits you perfectly. Like, I've had a mentor say, like, when I was feeling a little discouraged about finding a job, and she was like, don't forget you've been, like, born for this job, and, like, just enjoy it. But I think if I wasn't a child life specialist, I would definitely still be in the human services field, like maybe a play therapist or a recreational therapist. I definitely love the hospital environment because I feel like even though it's for a short time, you really can build relationships with your patients and kind of be that sense of calm for them in a really stressful time. So if I wasn't doing child life, I would probably do art therapy, recreational therapy, or play therapy, something where I could really get to know and build relationships with my patients.
Interesting and well thought out. And sometimes that is a tough question for panelists to answer. Eric, what do you think you would be doing if you weren't working in recruitment for healthcare organizations?
For me, I would say probably, I think I would be in like law enforcement or like a police officer. I have a mentor of mine who is somebody that grew up with my mother, who I'm really close with. And I just, like I've mentored and I've done like a lot of volunteer work. So I would probably be in a career that kind of, you know, I guess was like an intersection of those two things. And just my uncle, who is a New York City sheriff now, I think I would probably be doing something like that. Just because if I wasn't doing this, would want to do something where I was kind of out and about, but also where I was able to kind of, you know, interact with people in the community and, you know, make a difference. So I'm definitely thinking that that's probably the route I would have gone had I had not gotten into this field.
Interesting. Thank you for sharing. I always like this question because I think it gives people ideas that there are a lot of different options and that even if you don't necessarily take the path you first intended to take, there are some different options that you might take eventually. And then we'll go ahead and close with Steve on this question. What do you think you'd be doing if you weren't working in your current field?
Professor or politician.
I like it. Okay. Very nice. Well, I can certainly see that, professor could be a pretty easy switch for you. So I appreciate your participation in today's panel. I also wanted to thank Maureen Levetro and Eric Jackson for joining us on today's Career Coffee Talk webinar. I've certainly enjoyed hearing from all three of you, and I hope that the rest of our attendees today enjoyed it as well. If you are interested in following up with any or all of today's panelists, I have been assured that you are welcome to reach out to them using LinkedIn. So I'll go ahead and sort of put the charge out there to use the LinkedIn tool to reach out to the panelists as you prepare to do so, and I hope that you will do so. In closing today's webinar, you'll get a survey that pops up on your screen as soon as it ends. So please take just a minute to fill out the survey. And I hope that you'll consider joining us on a future program offered by Career Services at CUNY SPS. Have a great day, everybody. Happy Friday.
Have a good one. Thank you.
Thank you.